my cafe, my PetInfoCafe. Pour yourself a warm cup of your favorite and let's chat about our love of animals. I am your host, Jennifer Eileen, and I am so delighted to introduce our topic today, wellness for veterinarians and pet parents. Please meet our guests with VCA SouthPaws Veterinary Hospital, Dr. Heather Hoke, Internal Medicine Co-Medical Director, and Joelle DiMicelli, MSW, LCSW, Licensed Clinical Social Worker. Hello, ladies, and please meet our very special pet guest, Tucker. Hi, Tucker. Are you ready to be the star of the show? Okay, I've got lots of questions for you.
Well, first of all, we just wanted to thank you for having us here today. This is so exciting, and having watched some of your episodes, it's so amazing what you're doing for pets and pet parents, and kind of extending the knowledge and the wealth of our love for pets.
Well, thank you for that.
Of
And true transparency, Dr. Hoke is my vet as well, and I recently met Joelle. And I just met Tucker, but he's my best friend now.
That's right. He's everybody's best friend.
He's everybody. But so, Dr. Hoke, we'd like to hear from you about what it was like to become a veterinarian.
Yeah, no, of course. So when I was little, my grandparents had a dairy farm, and so I spent summers on their dairy farm, and I really just loved all the animals. I loved the cows and the sheep and the cats and the dogs and everything, and I've always just had a love for animals, and so I really decided at a very young age that I wanted to be a veterinarian. Growing up, I was from a really small town, and I thought that I would end up being a general practitioner, so kind of working with animals, vaccinating, and as I got further into my veterinary career, I just decided that I wanted a little bit more, and I wanted something that was more stimulating, difference every day, doing advanced diagnostics, really helping the patients that were really sick. And so that's why I decided to become a specialist. But the road to get there is long. So it's 4 years of graduate training, 4 years of vet school, and then if you're specializing, you do an internship, sometimes a specialty internship, and then a 3-year residency. And then that allows you to set for boards, which is what allows you to be board certified. So it's definitely a long road to hoe, but I wouldn't change anything. I love what I do.
Yeah, that's wonderful. And then you said that when you moved to this area, you decided to work for VCA SouthPaws for the largeness of it?
I did, actually. So I've always loved the DC area. And so I actually had a friend that interviewed at SouthPaws, and they told me I should come and interview. And I have to be honest, when I came, I wanted to be a better doctor. Like, it was so collaborative. People were meeting in the hallway talking about cases. Every morning we meet for rounds, talk about the cases that are in ICU, and there's specialists from every department there because we have multiple specialties, and it just allows us all to weigh in on those cases and make sure they're getting the best care possible. So I really loved the collaborative environment where people really were doing what was in the best interest of the pet. So it really just, it made you inspired to want to do better. So it made me want to come here.
That's really wonderful and positive. Now we must talk about the star of the set. Tell us about Tucker.
Yeah, so Tucker is my golden doodle. I've had him for about 5 years. He's a great dog. We've all been through a lot together. We went through COVID together and went through all of that. So when he was a puppy, I brought him to work from a very young age to be able to socialize him. So I'm lucky in doing what I do, I can bring him to work with me. So even though he's my dog, he's found his true love with one of our coworkers at work. So he goes home with me every night, but he earns to see her when I get to work. So,
I love
but he's really everybody's best friend.
He really is, and he's 5 years old.
He's 5 years old, yep.
So, and you've had him since a puppy.
I've had him since he was a puppy, yeah.
And what do you think about golden doodles? What attracts you to the breed?
Yeah, I have a golden retriever who I'm lucky enough, she's almost 13, so it's pretty old. So my husband really wanted a dog that didn't shed, so I really love the golden, and we were looking for a dog that didn't shed, and so he doesn't shed as much, but still has some of the golden retriever tendencies, which is nice. And every dog is different, right? You love your dog for who they are. So he's his own special character, which works out great for our family.
Yeah, that works out really great. And then the other thing about SouthPaws, for everyone to know, they're like 4 minutes from the studio where we're doing this interview. So I have been trying for years. I mean, we have our little collaborative session after you see my pets, and we talk, and I'm like, when are you going to come interview with me? So here we are.
We were finally, the stars finally aligned, so we were able to make it work.
Yeah, the stars finally aligned, so great. So want to hear more more about some of your veterinary experience, but I would like to introduce Joelle and something about how SouthPaws decided to integrate social work into the program.
Course. Yeah, so social work is pretty new in the veterinary field, and so there's not a lot of hospitals that have social workers. But I think for those people who have worked in hospitals where they have, you know, we have so many specialists and so many people with vast different experiences that, you know, we were hearing from so many people about how beneficial it would be to have a social worker. And so we really started to investigate that and decided we want a social worker. So it took about 2 years to find the right fit. And Joelle's with us now, and we couldn't be happier. Like, it is such a amazing experience for our clients, and it helps us out as veterinarians and staff members as well. But really to have someone there who's focused on the well-being of the client, making sure they're taken care of so that we can go back and care for the pets. Because, you know, we're veterinarians, we care about animals, but we care about our clients too. So when you have a client who's really struggling for any number of reasons, it's nice to know that we can have Joelle come in and she can be there with them and deal with their emotional needs, so we can really go back and focus on their pet, which is what we need to be doing at that moment. So we couldn't be happier to have Joelle, and it's been such a blessing for us.
Yeah, well, absolutely. So one of my first encounters with SouthPaws was that one of my dear cats of many years just died at home.
Wow.
And so they helped me rush to SouthPaws, and there wasn't a social worker at that time, but the person on staff was so kind, so gentle. He let me just sit in that room with her and just cry and sob and scream for as long as I needed, and then took care of all of the remains. So I've had very positive experiences.
Good.
Now, with you as an internal medicine doctor, you work with vets in the area when there are special needs. So, for example, in my case, I had a cat who has passed now, and he was having problems that my regular veterinarian had kind of reached the end of treatment. So, due to an emergency, I brought him to you. He stayed, and then you operated the CAT scan, which diagnosed him. So that's one personal example, but can you say more about that, just to help people understand what your what the specialty role is?
Medicine. So yeah, we do. So we're mostly a referral hospital, but we do have an emergency department. So take a lot of cases on primarily for that situation. But we really are a hospital where patients come to. So think about like the Mayo Clinic or a Cleveland Clinic or something like that. It's a place where you go when your GP can't figure out what's going on to get more advanced imaging and advanced testing. So we do a lot of work for the local community for those patients. So it really is, those doctors have exceeded or have gotten to the end of the diagnostic options that they have, and then they send them to us. And sometimes, honestly, it's reviewing the record and talking about things, and sometimes those clients choose to do nothing else, right? And that's okay. But for those clients like you who wanted to do advanced diagnostics, we had the capability of doing that to make a diagnosis, which unfortunately in Alexander's case wasn't a positive answer. But in so many cases, like, just having the answer gives you the power to make decisions for your pet moving forward. So I think that's for us, it's finding answers that we can fix, but if we can't, at least giving people peace of mind that they can make decisions for their pets moving forward.
That's right. So tell us more about the specialty of internist.
So as internal medicine, I deal with kind of the same thing a human internist would. So I mean, we're doing vomiting and diarrhea and liver disease. So I mean, on a daily basis, we're doing endoscopies and colonoscopies and CT scans and you know, all those advanced diagnostics that people don't always think about doing on animals. Having a diabetic kitty yourself too, you know, we use things like insulin and treating them, and using continuous glucose monitors to assess their diabetes. So many of the things that people do in human medicine, we're able to do in veterinary medicine to extend these patients' lives and really give them a better quality of life for their whole life.
Yeah, that's true. That's indeed. And was there kind of a pathway that led you to be an internist?
So crazily enough, when I was in vet school, I wanted to be a pathologist, which is you know, the study of diseases after animals have passed. And when I went to vet school, we had a really, really strong pathology department, which always makes you like that subject better when your teachers are really great. And when I got into clinics, I realized that internal medicine, it was like the search, and it was the hunt, and it was like the study of disease processes, but I got to touch the fuzzy dogs and cats, and I got to interact with their owners too. You know, I felt like I could make such a positive change on the front end rather than on the back end. Like on the back end, you get to give people peace of mind about what's happened in the end, but on the front end, I can make them better and I could establish those relationships. I love having relationships with my clients and seeing them back and knowing about their lives as well. And so as an internist, I get that. I get the long-term follow-up, but I also get the hunt for the disease to try to make those pets better.
Okay.
So it's kind of the best of all worlds for me.
And then within SouthPaws, as I've seen, there are people who specialize in cancer. There are other kinds of diagnosis that can be managed.
So there's so many different specialties now. So I mean, there's neurologists and radiologists and surgeons, medical oncologists, radiation oncologists, ophthalmologists. There's so many different disciplines that we have access to, which allows us just to provide better and better care for our patients. Critical care specialists, within our ICU. So it's pretty incredible.
Yeah, and I noticed that because when I brought Alexander in, I had noticed that his eyes were dilated differently, and your ER doctor, I don't remember her name, but she said that sometimes that was a sign of cancer, which is what we ultimately discovered.
Right.
But there was kind of that breadth that helped us both. Well, saying more about becoming a veterinarian, do you have any advice for someone who I have so many coworkers who say, my daughter, my son wants to become a veterinarian, but I told her to go to medical school because it's less expensive.
Yeah, I think that's an interesting question. A lot of the people who are in medical school now, who are MDs, definitely talk about the struggle of dealing with insurance and coding and all that, which I don't have, So I think that I would compare my job kind of like to a pediatrician, right? Because I have the pet and the parent, right? And so kind of like having the baby and the parent. So I wouldn't change what I do. I love being a veterinarian. And the truth is, like being a veterinarian, say I got hurt or for some reason I didn't want to do clinical practice anymore, there's so many other opportunities. So, I could go into creating policy. I could go back into academia and teach people. They work in food safety. They work in product development. So developing vaccines, developing food for animals. So I could consult just via over the phone. So there's so many things that I could do that aren't just tied to clinical practice. I love what I do and I don't plan on changing that, but if something were to happen, there's so many other options for me to consider.
Very interesting. And you think so too.
I know, I think you found a new love.
Well, it's really interesting because I had a allergist tell me years ago that I should get a poodle or some other kind of dog and not a cat. But what do? I still have cats. But anyway.
Well, I think tonight will be the test if your eyes are itchy or not, right?
Right. Yeah, they would be now. But I think that's so. Just in the interest of other kinds of careers that people have, let's talk a bit to you, Joelle, about how you found a career in the veterinary field.
Yes, well, it's really fascinating because not a lot of people know about social work in veterinary hospitals. When I learned about it, I just thought, oh my gosh, how did I not know this? My whole career. It's very new, and there are not a lot of hospitals that do it, which is why a lot of people don't. But the more I learned about it, I just thought, oh my gosh, this is invaluable. And when SouthPaws reached out to me and shared with me, about the hospital and what they do and the need for a social worker, I said, oh my gosh, this is my heart. This is taking my love for helping people, my love for animals, my love for medicine, because I have a background in working in human ER.
Human ER.
And my social work background is pretty diverse. So I feel like I focus a lot on crisis intervention and trauma and grief and loss and just helping individuals, groups, families. And this job really uses every single skill, every experience I've ever had, and kind of puts it all like this was meant to be, right? Like you were preparing for this.
Yes.
And I get excited, and when I tell people what I do, they always say, what? And then when I share with them, I'm there for the clients. I'm there for, I say, pet parents, right?
Yes.
And as Dr. Hoke mentioned, I tell people just like a human hospital. We have pediatricians, and then they have the support for the families, and that's what I do, is I support the families. It's very hard on them. Anytime someone comes in, whether it be, you know, to the ER or if they're coming in to see, say, oncology, right? It's not where they wanted to be. No one woke up that day and said, yeah, let's go to the ER, or, you know, it's usually sad news. And, you know, it's really nice to have someone, you know, to be there for them, to listen and kind of solely focus on them and help them, whatever the next step is going to be. You know, so I think my coming into finding Southpaws finding me, I, again, I feel like it was just the way it was supposed to happen, and I'm so glad. I had no idea that this was an avenue, and that, you know, this was going to turn into where I would be in my career now, but I'm really happy, and the more I learn and the more I work with the doctors, I'll tell you, the more I want to do it, because the more I'm into it and working with people, I know this is very important work, and what they're doing is important, and people really need to have that support.
Well, it's a dimension, as you were saying when we were talking earlier, to the total vet experience, because you know, someone like me has a stressful decision to make, and you can support me, and then Dr. Hoke, as the physician, can focus on, you know, what the treatments might be, or what the options are. Can you just say more about that? You can use me as an example. Or anyone
sure.
else.
I mean, you know, a lot of times I think, you know, I know I've been, you know, with my animal and I didn't have anybody, or people are walking through the door and they have other things, you know, the whole person is coming into the door,
whole
right?
person, right?
So whether that be they're walking into the door with, they already have someone in their family that might be ill, or they've just lost someone, okay, or they have someone that's in the hospital, or they have children at home, or they're a new mom, or they just lost their job, or whatever's going on in their life, they're coming to us, and they're in, most likely they're in a crisis, you know, and they need that support. So they're walking in the door, we don't know what else is happening in their life, and they also have their child with them, and they may not know what's happening, and so they're coming in, and their nervous system is shot from the door, right? So whether it just be, I will tune in and figure out, okay, sometimes it's just, let's just sit down and breathe, right? Helping them figure out, you know, their baseline, where are they?
Okay.
And then saying, okay, I'm gonna walk you through what to expect, helping people with their expectations, right? They've never been to a vet hospital before. Sometimes people are coming in, they don't know what's gonna happen, they don't know how long they're gonna have to wait, or what's the next step. And I'm that person to walk with them from the beginning through their entire hospital stay. So whether it be an emergent situation, okay, and they're dealing with the trauma of something that just happened, or it be they're coming in to talk to a doctor about, you know, possible, you know, cancer diagnosis, or they're just there and they're coming in, they don't know what's going on. Their pet might just be acting funny, or, you know, throwing up, and they have to see internal medicine. You know, whatever it is, it's a new world for them, and there's other things going on. So I'm there to be an advocate for them, help be a liaison between them and the doctor, also to educate them and help them understand they're not alone, to validate what they're feeling. A lot of times I'll hear, you know, I don't know if I did the right thing. Did I wait too long? Or, you know, I think as humans, there's a lot of, the initial thing is the humans will beat themselves up. Or, you know, and I say, hey, you know, it just takes you did the right thing, you know, it's gonna be okay. Just people need to hear that. People need to hear that, you know, what they're feeling is valid, and they need, you know, to understand there's someone there for them, and that, you know, walking them through how do they process what's happening, you know, and that it's okay sometimes just to cry, to let go, or to ask questions. You know, sometimes they're not sure that, and the doctor will come in and I'll sit with the doctor, and I'm that extra set of eyes and ears, right? So then the doctor will be able to go back to the pet, and then I can sit and say, okay, so do you have any other questions, or what did you hear? And then I can kind of work with them and talk to them about what's the next right thing, you know.
Yeah, that's very helpful. And Dr. Hoke, so can you say more about how that helps the veterinarians?
Yeah,
Because it kind of helps you with your...
It's huge for us because, I mean, like I said earlier, like we love the pets, but we love their parents too, right?
Yeah.
And so I know that when those pet parents are there and they're in a crisis, their biggest worry is their pet being cared for, and they can't see what we're doing in the back. So having Joelle be able to really keep them grounded so that when we get there, then we can, you know, they're able to receive the information that we have. You know, they're able to assimilate things better when they're not in such a stressed situation. So by the time she spent some time with them breathing and decompressing, you know, it's just everybody's in a better place to have a conversation to ensure we're providing the best care. But with that being said, you know, after a difficult case, it's hard for us too, right? So a lot of those pets, after, say, we've had a case we've been caring for a week in the hospital, and unfortunately they don't make it. That's very hard on us as the doctor because, you know, we've cared for that pet, and then, you know, we've cared for the client, and we feel invested in that situation. It's hard for the staff because those are the people who have really been providing that care for the last week, and it's really can be very traumatizing for them. And so having Joelle there to be able to help us break things down, help us, you know, establish a baseline again so we can give 100% to the next patient. Like, it's really important to be sure we're in a good place, that we're providing good care. So I think having Joelle helps in a situation by situation basis, so in a case by case basis, but she's also able to train some of our staff and give them information about identifying a crisis, how to approach a client who's dealing with a crisis, and give them tools so that when she's not there, because she can't be there 24/7, that they can help to provide the best care possible for those patients too. So I think she's so important for our pet parents, but it's so important for us, not only so we can do our job more effectively because she's caring for them, but also to help us debrief after something's happened and help us really recognize that mental health is so important in making sure everybody's taken care of so that we can all go on and take the best care of patients moving forward.
Yes, and their parents and all of the above. And the anecdote that I have to share is about that is that this wasn't with SouthPaws, this was with another hospital, but I took a cat in and it was his time. He was a feisty, ornery little cat, but they all loved him there. And so when it was time for us to, you know, help him across the Rainbow Bridge, the vet was crying. She was crying as much as I was. Because she had a personal connection, and that, you know, that didn't make me happy, but it just helped me to understand, you know, what you're saying, that there is mutual stress. And, you know, we know that from a standpoint of a pet parent, sometimes we don't understand, you know, and we feel guilty. The pet parent feels guilty, and so it might be, you know, are you doing the right thing? What are you doing? You know, and dealing with that situation as well, I'm sure.
I think, I mean, to that point, I've had multiple pets, but there's been a couple I've had to euthanize. I had to euthanize someone else's pet on the same day, and even though it's not, it's always hard, you know, I mean, like thinking about making that recommendation for euthanasia, and in the back of my mind, I'm thinking, I have to do this myself tonight. Like, it can be very agonizing and very hard, and I mean, it really, it brings all of our hearts together, right? I mean, at the end of the day, we're pet parents too, and loss is loss, and it's hard, and we all have to be able to get through it and get through it together. So I'm happy that we can be there for them, and that Joelle's there for them and there for us, because it's just so important in being able to move on and have I mean, our environment at SouthPaws is amazing, and it's amazing because
really is.
Like, people are happy and people work well together, and that we can all support each other together. So everybody's there for a common goal, which makes it such an amazing place to work.
Well, I think that's important to say, because as I said, in my first experience with SouthPaws, I didn't really know SouthPaws, but I had a cat that I needed to take care of very suddenly. So that was that was like 20 years ago.
Well, and definitely not where you expected to be that day, right?
Not where I expected to be.
It's very traumatizing sometimes.
Well, before we close, it's so important. Is there anything else that you wanted to add, Joelle, about your job and what you do and how you do it?
I think this is such important conversation. I think that's really where the passion is, because there's so much I could say, right? And I think hearing Dr. Hope bringing some things in, I think it's just important to know that, you know, grief is, and our pets are our children, and they're we love them, and that honoring that bond with them, and whether it be when they're sick, or if we know we have to say goodbye, or transitioning, right? Just making sure, again, knowing that there's someone there and there's a group of people to help you and to support you, and that you don't have to do it alone, and that it is the common thing. I always share with pet parents. I say, everyone says our pets teach us, how to love each other. And when we're doing a lot of, quality of life and end of life conversations, I say, but I want you to remember, they want us to love ourselves the way they love us. They're here to teach us that. And that helps pet parents be kind to themselves, give themselves grace. And I think that's what we do. That's what I try to do with the staff, reminding them that, it's okay to cry. Come to me, we can process it together. Just like I do with the clients, taking care of the mental health and helping them and giving them tools. And nobody has to do it alone. And that's why I'm so excited about this job and social work. It just makes so much sense,
Well, thank you both for that. So as we kind of close up and wrap up, are there any last thoughts that you'd like to share?
No.
Tucker, anything?
No, just thank you so much for having us. We
Yeah,
think
thank
this is
you.
such an important topic for people to know about,
Yeah.
and we're so lucky to have Joelle and be able to offer that at our hospital. It's so incredible for our staff and for our clients.
Well, thank you very much,
Yeah, of
both
course.
of you, and come back and visit us
Of
again.
course.
We're right around the
Thank you
corner.
so
That's
much.
Right. Thank you.
Thank you.
I hope you've enjoyed our very special episode. For more information about this and other episodes, you may visit PetInfoCafe.com.